Hi, my name is Atif Darwish, professor and consultant of obstetrics and gynecology. In this short video, I'd like to show you the importance of delicate hysteroscopic surgery in treating intrauterine abnormalities. And in this case, we will show the use of microscissors to make lysis of adhesions, occluding one of the parts of the uterus, and you cannot see the tubal ostium and the whole Darwish Hysteroscopic Triad. And Darwish Hysteroscopic Triad actually is a conical part of the fallopian tube seen via hysteroscopy, and it has been published by our team before. And actually, it is a conical shaped part of the fallopian tube. Its base is ostium. Its walls are converging intramural parts of the fallopian tubes, and the summit of this cone is the dark spot, which is the narrowest part of the fallopian tube. And here you can go by diagnostic hysteroscopy into endocervical canal, and with gentle approach, you can see the internal os of the uterus, and some endometrial shreds are seen. And you are approaching the endometrial cavity. Here on the left side of the patient, you can see tubal ostium covered by some endometrial shreds, but it looks normal. And when you go back with the telescope and try to see the right side of the patient, you will be confronted by adhesions occluding left upper part of the endometrial cavity and masking Darwish Hysteroscopic Triad. So you cannot see the ostium, the intramural part of the fallopian tube, or the dark spot. And here you start to localize the or expect the site of the right Darwish Hysteroscopic Triad by focusing on the left side and try to move in a horizontal way. And this site is completely occluded by dense adhesions. So you have to introduce delicate instrument here, which is microscissors. If you use the resectoscope, this is not recommended because it will destroy the tubal ostium and the intramural part of the fallopian tube. So you will lead to an occlusion of the fallopian tube by iatrogenic approach. So you have to use delicate instrument, which is microscissors. You cut the thick adhesions, including the right side of the uterus, and every time you have to go to the left side to see the normal ostium and go in a horizontal plane to reach the site of the, or expected site of the ostium on the right side, which is the base of the conical part, which is Darwish Hysteroscopic Triad. And just continue to make adhesiolysis in a gentle way and in an accurate way to avoid perforation of the uterus. And every time you go to the left side to see the ostium and go in a horizontal plane to reach this site, expected site, and here lateral wall shows extensive adhesions, and you cut extensive adhesions, and mostly you reach the site, and now air bubbles go inside this site. So the ostium, this is the site of the ostium because air bubbles, which is post-bubble test as a part of Darwishoscope test of patency and peristalsis, also published by our team. And you have to continue of adhesiolysis to cut all fine and thick adhesions around the Darwish Hysteroscopic Triad. And now you can see the ostium, and you can go to see the intramural part of the fallopian tube and the dark spot. And again, you continue to make adhesiolysis of some adhesions away from this Darwish Hysteroscopic Triad to make the corneal end of the tube as normal as the left side. And you have to be very meticulous to avoid perforation or damage of the healthy endometrium. You should focus on the adhesions, and the adhesions are whitish, thick avascular tissues, as you see in this view, while the endometrium is healthy and vascular, which bleeds on touch. By this way, you expose the ostium, and which is the base of the Darwish Hysteroscopic Triad, and you can reach to the summit of the triad, and fertility of this patient now becomes normal, and you go inside the Darwish Hysteroscopic Triad to see fine adhesions inside the triad, which is inside the intramural part of the fallopian tube. Again, you go through it and cut these fine and delicate adhesions inside the triad, which actually they are tubal adhesions, not intrauterine adhesions, and the maneuver should be delicate, and you have to go forward, and here air bubbles also go inside the tubal ostium, which means regained patency, but still some fine adhesions require adhesiolysis, and until you expose, these are intratubal fine adhesions inside the intramural part of the fallopian tube, and they should be cut in a gentle way, and using also Hilton technique, because they are usually fine adhesions, and don't be aggressive to avoid damage of the fallopian tube, because following the converging intramural part is the summit of the cone, which is the narrowest part of the fallopian tube. Any damage can lead to occlusion of the fallopian tube. By this way, the Darwish Hysteroscopic Triad is exposed in a perfect way using microscissors, and this is another advantage of delicate hysteroscopic surgery in infertile women. Thank you very much.